So what do we do? How do we keep ourselves patient, calm when we are making prescriptions, and how do we grow using the MAP system? I think the most important thing that all of us need to realize is that the remedy need not be found. The remedy is across the table, like Bhavisha and I have always said. It is there, it is talking, it is speaking. The only difference is that we can't exactly understand everything that has been spoken, but it is giving you the remedy. What we ought to do, we ought to stay calm and silent and listen rather than ask.
Very often, I have seen this in practice. I have seen this with colleagues. I have seen this with, people who study under us or some other friends who may ask us for, tips, or they may ask us to solve a difficult case or something. Very often, I have observed this and they have also given me the feedback. And what is it? They've told me that when you did the case taking or when you prescribe, it is not a very different prescription than us. Or it's not a very different style of case taking. Like you don't bring out, like the magician brings out things from the box. Not like that. But because you are more confident, or because you are, that is in case taking, or because you stick to a prescription more confidently and surely and firmly than us, the remedy works better. You understand? So one of the things that I've seen is not that I know more, right? Or that I have some great wisdom or something, as opposed to someone who's just taken my help for a case, or, who's trying to learn from me. But I think the trick is more the confidence and the faith. I will not only put it as confidence, and also faith is important. And very often when we do seminars, when we talk about improving skills and improving homeopathic practice, or we talk about helping beginners, most people only focus on materia medica, case taking and things like that. But I would say 90% of the success comes from two very important things: faith in the pathy and faith in ourselves. And because of that faith, confidence in our case taking, confidence in our demeanor when we are taking the case, confidence in our demeanor when we are telling the patient, the prescription, or giving them some advice, or giving them a treatment plan. And then the confidence during follow-ups. One very important thing that I would like to tell you is our pathy can actually create miracles. And not just Shachindra and me, we all have cases like that.
Absolutely.
Yeah. So homeopathy can definitely create miracles. We have seen that in our practice with acute cases, with chronic cases, immediate results. Yeah. So believe in it. And also believe in the fact that you as a homeopath can definitely create it. It's better. But sometimes what happens is we as homeopaths want that if we have given belladonna 1 ml, in the next 10 minutes, the fever has to go. You understand? So we expect superhuman miracles from homeopathy. Yeah. We expect miracles when they are not meant to happen. And then we start doubting ourselves and our science. And believe me, the patient can see that doubt. So this, I feel, is one of the things I have often seen, especially in students who are learning, or, who are with us, or there are some, students who come and present a case or whatever, and I can see that they have not been so bad with their prescription. They have been very shaky about when the prescription is going to work, how long will it take? Should they repeat the next one or not? All this will be, one is improving this homeopathically, but the second thing is improving this by having knowledge
Yes, that he does
about the
because it's
pathology.
way too popular. And he believes in homeopathy. He takes homeopathy from us for a long, long time. He's been doing well. Uh, his constant effort had been to overcome personal challenges, personal issues, and to rise above it, to do things for a better cause, and to master the me, the I. And he always had that quest. He would get into meditations. He was very good with everything that he was doing, but his deeper state was that he has to be the master of his journey. He has to be the master of his pathologies, and he had certain pathologies which he worked his way out, but he felt he needed help to do that. He was very confident in everything what he did, very confident as a physician, and I gave him the remedy gadolinium. Yeah, and I knew he was highly sensitive to this remedy. So I said, before you take, I asked him to take gadolinium on a couple of times. And then as he felt better, his physical complaints were better, his cramps were better. He had amazing dreams of pathologies that could possibly be in his system. He said, I don't get them, which is good. And then I asked him that don't take the remedy, but keep the remedy under the pillow. And once, after a few weeks and months, I'm kind of compressing the whole case. Yeah. And after a few months, the remedy was off the pillow. He was doing well. And then few months back, he said, I need to tell you a unique experience. I said, tell me. He said, I was going through a very difficult phase in my life. There were a lot of mental turmoil, mental thought process that I need to get over and overcome and maybe do something better. And I need to reflect inwards about it. I was thinking that and I went to bed. But as I went to bed, I realized in my dream, I said, voice said to me that, hey, you are in the gadolinium phase. The master is within you and you can take care of your problem and the problem will be gone. And he said, next day morning, I woke up and my problem was gone. I did not find the need to take gadolinium. I did not find the need to keep gadolinium under my pillow, but just the thought and realization I could find a way out and I felt better. Now you can imagine somebody who has got no connection with homeopathy, believes in homeopathy, but no connection to the depth at which homeopathy works. He calls me up to say that, "No, no, this is an amazing experience because without taking," he said, he asked me, is it possible to feel better without having the remedy next to you? I said, absolutely. Our remedies create realization. He said, I think I had an experience like that. And he narrated the whole thing. It was an amazing thing to know and to hear and see it from somebody who has got no connection to it. So one of the easiest ways of making good and surer prescription
And
is
also quick.
and quick, of course, but surer. I think the surety is far more important is to use the map system. And whichever method you use, yeah, sometimes you might repertorize a case and come to a remedy. Put the map system on every prescription of yours, where you match the prescription with the level of the patient that belongs to, select the remedies from the level, the way they have been distributed, and prescribe them. Your results will be way more better than randomly selecting a remedy just based on certain few symptoms. A deeper level collaboration between the patient and the remedy gives better results. So that is very, 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 very important. It's as good as having a, what do you call it, a grid where you can really put every prescription, everything that you're trying to use to prescribe based on levels and columns and titrate and see where best does it correspond to your patient's behavior, make a prescription.
Absolutely. The column is the patient's daily behavior, his everyday conduct, how he conducts himself every day, how he behaves every day, how he deals with everyday life situation, and what does he do to achieve these goals. Okay, that is the column. Yeah, how motivated is he or she to achieve what he or she wants.
So life case seminars, anywhere that you attend, and they are immensely beneficial because you can take the case along with the other person who's taking the case who has made a good prescription. That helps you refine your art of case taking, refine your questions, refine your thinking pattern. Often you should put a question when you're reading through cases, especially those of you who are part of our tonic group, is to put yourself in a spot and understand, why did I or she ask this particular question at this point of time? What would you have asked? You will be joining us for this live case seminar event. So those of you who are thinking, think strongly about it. It's a lovely 4-day classroom event. So join that, join the monthly tonic or anything, or we'll have these chai times, over a period of time. Those are just about tea bits. But if you want a good proper meal, join one of the events so that you are filled up for the next maybe XYZ months and you can get the fruits of that in your practice. You'll get a glimpse of about our latest work that's going on, some information about the plants that we are working on and reptiles. Yes, some pathologies that we are going to deal with.
Oh,
Yeah. Absolutely. Yay. A big thank to Dr. Zainab, who has been with us for a very long time. And she knows us and our clinic working far more better than Bhavisha and me. She's played a big role in helping this tea time reach everybody. She and Smita from our clinic have really worked hard to ensure that all our work comes to its proper ending.
And Zainab is a wonderful prescriber by herself, very painstaking in all her, in the way she takes her case, in the way she comes to the analysis of cases. Extremely intelligent and diligent homeopath.
Dedicated.
Very dedicated and absolutely a pleasure to have in the clinic. And we are so fortunate that we've had her contribution in the clinic for so many years. So much, Dr. Zainab.
And we all hope to see you all either online, offline very soon. Thank you.
Bye bye.